Hi everyone, today we are going to discuss about vitamin D. We know there are two types of vitamins, water soluble vitamins, that is vitamin B complex and C, and fat soluble vitamins, that is vitamin A, D, E, K. Vitamin D has gained so much importance because vitamin D is now considered to be the sunshine vitamin. So previously we used to think that 90% of vitamin D should be got from sunlight and 10% should be got from milk, dairy products, fish liver, fish oil, egg yolk and fortified cereals. Now the guidelines say that you get your sun exposure more than 2 to 3 minutes per day, your chance of skin cancer, especially malignant melanoma and basal cell carcinoma, is very high, and photoaging is a reality. You get more than 15 minutes of sun exposure per day, your DNA in the cells can break down, you can age very fast, that is known as photoaging. So our conventional concept was sunshine vitamin, you go and get enough sunlight, your vitamin D is there, and only 10% you need to get from diet. Now US Dietary Task Force says that 90% of vitamin D should be got from supplementation. Either milk, dairy products, fish liver, egg yolk or fortified cereals, or you should take vitamin D as capsules, tablets, granules or nano shots, whatever that is required, because the risk of skin cancer and photoaging. And what is the benefit of vitamin D and the adequate vitamin D in the body? Many people come and ask us, doctor, what is the adequate time of sunlight for adequate vitamin D synthesis by the skin, and how much minute of sun exposure should I get per day for adequate vitamin D synthesis? Now the guidelines say that, clearly listen, you require 2 hours of sun exposure per week in a person who is fully covered with exposure to the face and dorsum of hand and feet. Look at a person like me who works in a hospital. I may be wearing a coat, I may be wearing a full sleeve shirt. So where do you get sun exposure? I get sun exposure on the face and dorsum of hand and feet only. In such a person who is fully covered with exposure of the sun to the face and dorsum of hand and feet, you should require 2 hours of sun exposure per week, that is 80 minutes of sun exposure per day. In a person who is wearing only a diaper, I am wearing only a diaper and going and getting a sun bath in whatever resort that is available, I require only 30 minutes of sun exposure per week. So basically, sunlight vitamin or sunshine vitamin is vitamin D. Gone are those days where we tell that 90% of vitamin D should be got from sunlight. Now 90% of vitamin D should be got from supplements and 10% if at all from casual sunlight. If at all you are getting sunlight, what is the duration of sun exposure? 18 minutes of sun exposure per day in a person who is fully covered with exposure to the face, dorsum of hand and feet, and 30 minutes of sun exposure per week in a person who is wearing only a diaper or a bikini. And how much duration or which is the best time in the AM, PM so that you get adequate vitamin D? Previously, everyone used to say you go in the sunlight in the early morning, 7 to 9. That's the best time to get vitamin D. Now, studies have shown that early morning 7 to 9 is UVA. That is UVA, that is ultraviolet rays A, 320 to 400 nanometer. That is best for poor therapy for psoriasis and vitiligo. If you have to get vitamin D, you have to get exposed to UVB. That is between 11 to 3 o'clock. That is mid-noon sunlight. So that is why now US Dietary Task Force says that you go and get 80 minutes of sun exposure per day. That between 11 to 3 o'clock mid-noon, your sun is exposed to high intensity UVB, high chance of DNA breakdown, photoaging and skin cancer. Better take a vitamin D supplementation. In spite of getting adequate sunlight exposure, vitamin D synthesis is poor in 90% of Indians, because study says that Indian, even if they are looking very fair, suppose a white Indian also, you look at the epidermis, the melanocyte content of the melanin or the melanocyte and melanin content of the epidermis of an Indian is thought to be much higher. So melanocytes always have a photoprotective effect. So as an Indian, I am going and getting 1 hour of sun exposure per day between 11 to 3 o'clock mid-noon also. My vitamin D synthesis is very poor, so there is no guarantee that sunlight exposure will maintain your vitamin D in the adequate level. That is why now the international recommendation to maintain vitamin D in the minimal 25-hydroxy vitamin D level of 40 to 60 nanogram per ml. So basically, every person aged more than 1 year till 80, 100, whatever years should take 2000 to 4000 units of vitamin D to keep your vitamin D level. So how do you check vitamin D level? It is by checking 25-hydroxy vitamin D3. The minimal level is 30, preferably it is 40 to 60. So whenever a person is exposed to sunlight exposure also, Indians 90% are vitamin D deficient. And how do you take vitamin D? Vitamin D is usually having tablet form, capsule, you have granules, some people have mouth films are there, it is injections that are nano formulations there. So we have vitamin D in true international units, 50,000 is the international representation. Any country other than India, we have vitamin D capsules or injections, 60,000 units. So this is a vitamin D tablet of 50,000 international units. This is tablet form of vitamin D, and this is nothing but vitamin D nowadays nano shots, that is solution form. So 50,000 in 2.5 ml. So this can be taken as an oral solution. This can be taken as an oral tablet, and now vitamin D injections are there. You have 6 lakh injection given once in 6 months and 3 lakh injection given once in 3 months. This is more useful for children who are non-compliant. A mother gives vitamin D daily to a child is non-compliant, or my father age 82 years is non-compliant daily taking vitamin D. Better is to give him a 6 lakh injection once in 6 months or a 3 lakh once in 3 months per se, and that is also useful in people with malabsorption. Any malabsorption, ulcerative colitis, Crohn's disease, celiac disease, that is always good, and people with chronic renal failure. So just understand, sunshine vitamin is vitamin D. Gone are those days of getting vitamin D from sunlight exposure. Whole of vitamin D should be got from supplementation, either as tablet or as nano shots taken 50,000 once in 2 weeks, or injection of 3 lakh taken once in 3 months, or 6 lakh taken once in 6 months. And always check vitamin D by checking 25-hydroxy-vitamin D3. The minimum level is 30. Preferably it is 40 to 60, and sunlight exposure, if at all you have to get, it is not early morning 7 to 9, it is mid-noon sunlight 11 to 3. That is not preferred because of high chance of skin cancer and photo-aging causing DNA breakdown. And basically, what is the advantage of taking vitamin D? Many people come and ask, is vitamin D is this much hyped or overhyped? If you take vitamin D, what's the benefit? Always understand, vitamin D maintaining in the preferable range of 40 to 60 nanogram per ml have certain benefits in the body. Dementia to depression, schizophrenia. So it can help in dementia control, dementia, depression, schizophrenia, upper respiratory, lower respiratory transmission. Now studies have shown that maintaining vitamin D in the preferable range of 40 to 60 nanogram in children reduces the upper respiratory infection by 90%, reduces chance of tuberculosis in you and me by 50%, influenza by 27%, and corona infection by 17%. So simple vitamin D, a 50,000 tablet which in India cost you 20 rupees, here which cost you 5 dirham. That is taken once in 2 weeks. That is one tablet taken once in 2 weeks. So 2 tablets once in a month. A 50,000 solution of 2.5 ml. Take once in 2 weeks, or 2.5 ml bottle once in a month, and an injection of 3 lakh taken once in 3 months, or 6 lakh taken once in 6 months. Benefits somewhere. It is not a costly product which cost you 20,000 dirham or even 100 dirham. It is a product which is to be taken once in 2 weeks, just 50,000. Benefit in dementia, depression, schizophrenia, reduced upper respiratory infection, improvement in cardiac health by reducing diabetes, hypertension, insulin resistance, bone protection, osteopenia, osteoporosis, osteoarthritis, and immunomodulator function, and immunodevelopment function in multiple sclerosis, rheumatoid arthritis, type 1 diabetes, and always increase the muscle strength. So this is a cheap vitamin, sunshine vitamin, a cheap vitamin. Now guidelines say that you no longer have to check vitamin D every now and then. You may check vitamin D in certain group of people and give a higher dose of vitamin D in certain group of people. The 4 group of people where you may check vitamin D is age less than 18 years, age more than 75 years, pregnancy, and pre-diabetes. Otherwise, gone are those days, every month checking vitamin D, 30, 40, 60. Now insurance companies never allow you to check vitamin D now and then. You just maintain your vitamin D in the preferable range of 40 to 60. For that, you just need to take 50,000 once in 2 weeks. So 50,000 you are taking once in 2 weeks means 1 lakh international units in a month. So daily you get 3,000 units per day or 3,300 units per day. That is enough. That will not cause hypervitaminosis D. Hypervitaminosis D occurs if you take more than 10,000 units per day, that too for a prolonged period. And vitamin D is a fat soluble vitamin which can be stored in the body for a long period, not like B complex. It's a water soluble vitamin which is excreted to the kidney. So this is the basic to know about vitamin D. The only concept you have to know is vitamin D has some benefits somewhere. It's a sunshine vitamin but no longer got from sunlight per se. If you want to check vitamin D, always check 25-hydroxy-vitamin D3, and vitamin D can be given orally as tablets, capsule, granules, films, or nano formulation and injection. Suppose a person, you are having vitamin D nano formulation, you are having vitamin D tablet and injection, which is the best bioavailable form. The most bioavailable form of vitamin D, which is maximally absorbed, is the nano and oral shots. Many times the injection of vitamin D, the vitamin D bioavailability is much less compared to the oral formulation. But injection of vitamin D we prefer in children, we are non-compliant, or elderly more than 75 years, people with malabsorption where it is not absorbed, and people with chronic renal renal failure. And daily taking of vitamin D and monthly taking. Many people consider daily taking as good, but now study says that you are giving a person 2000 units of vitamin D daily, and your vitamin D level rises in the body after 14 days. You are giving vitamin D once in 2 weeks. Your vitamin D, you are giving 50,000 shot. Within 24 hours, your vitamin D may go high. So both will reach a stable level by 1 to 2 months. So basically, vitamin D, cheap vitamin. Everyone should take vitamin D. The 4 main benefits are always muscle strength, and second, bone and mineral density, calcium phosphorus, immunomodulatory function, and control of infection. That's the story of vitamin D. The basic of vitamin D that is updated till date that you need to know. The story of vitamin D in short. Thank you.